2014, my beautiful wife, Sandra, and I were expecting our first child. Close to the due date, my wife felt unusual movement, and being first-time parents, we were understandably nervous, so we rushed to the hospital. The medical team identified that the baby had placed herself in a breech position, and in an act of stubborn determination that we would come to know and love in her, she wouldn't be moved. Within minutes, an emergency C-section was called. My wife was calm and brave. I felt like someone had just swept my legs out from under me. A few moments later, I entered the surgical theater to hold my wife's hand during the birth of her daughter, geared up in the full suit of protective equipment, from the very sexy bonnet on my head to the shoe bodies on my feet, all in the name of keeping germs out and the surgical theater sterile. I was nervous and wanted my entire focus to be on my wife. But I could not help but be distracted when I noticed healthcare workers using their smartphones in the theater, gloves on, in a supposedly sterile environment. In my defense, and I couldn't help it, as a molecular biologist, I knew about all the germs that had just hitched a ride on those phones into that room where my wife's body was exposed through her C-section incision and where my newborn daughter, Emily, was taking her first breaths. And trust me, the germ situation is not good. I didn't say anything at the time. I don't know whether it was the absolute joy and overwhelming sense of love you feel at witnessing the birth of your child, or the fear of what my wife might do if I brought my day job work into her emergency C-section. I just stayed silent. And in the following weeks and months between the nappy changing, the sleep deprivation, and the joy, it dropped out of mind. I assumed that someone else would realize the absurdity of sterilizing every tool in the room and having everyone wear protective gear while allowing people to bring unsterilized smartphones into that same space and touch them with the very gloves used in patient care. 3 years later, we were back at the hospital. Our second baby, Matteo, decided to recreate his sister's renegade's move. This time, a transverse position. Another C-section operation followed. And once again, I saw healthcare workers with smartphones in the surgical theater. That was it for me. It had now put both of my babies and my wife twice at elevated risk. Now it's personal. I decided I needed to act. Step 1, no more babies. And step 2, I will use my research as a molecular biologist to expose smartphones for what they are, a wonderful tool that, left unchecked, is a biological hazmat situation we all carry around with us every day. I am on a mission to teach the world how to use smartphones safely from a biological hazard perspective and to make our hospitals, healthcare settings, and quite unexpectedly, our biosecurity safer. So let's talk microbiology for a moment. When we say germs, we're using a broad term. It includes bacteria, viruses, fungi, and protozoa, microscopic organisms that exist everywhere. But it's important to say this clearly. Not all microbes are bad. In fact, many are essential. They help us digest food, produce vitamins, and even protect us against infections. We wouldn't survive without them. But that's not what we're talking about today. Today, we're talking about the germs that cause disease, especially if you are immunologically incompetent, vulnerable, and fragile. The ones that don't belong on surgical gloves, in neonatal wards, or on devices that constantly move between hands, faces, and environments. And that brings us to mobile phones. Because your phone is effectively your third hand. According to the Center for Disease Control, the CDC, around 80% of common infectious diseases are spread through hand contact. And that's why hand washing works. And it's why a contaminated phone quietly undoes it. We touch our phone thousands of times a day, on average for 3.5 to 4 hours. And unlike our actual hand, this third hand is almost never cleaned. From a microbiological perspective, your phone is an ideal environment for microorganisms. It's a high-touch surface, it's constantly recontaminated by your fingers, and over time, it accumulates bacteria, viruses, fungi, and protozoa. In other words, your phone is less like a personal device and more like a 5-star accommodation hotel for microbes. Think about why. First, moisture. When you speak on your phone, you spray it with microscopic droplets of saliva. That creates exactly the kind of humid environment many microbes love. Second, heat. Phones warm up when they're in use, which turns that humid environment into something closer to a heated spa. And third, food. Skin cells, organic debris, and sometimes actual food. If you ever eaten while scrolling your phone, congratulations, you fed the guest. And then there's the bathroom. Studies show that between 50 and 80% of people use their mobile phones in the toilet, which helps explain why we consistently find fecal and gut-associated microorganisms on phones, including E. coli, Salmonella, and Enterococcus fecalis. Your phone doesn't just travel with you, it carries living microbes and contaminants from where you've been to where you are now and where you're going next. This is unpleasant in everyday life. It means the phone you take into the bathroom is the same one that ends up on your dining table, in your kitchen, and in your children's bedrooms. But in healthcare settings, it becomes genuinely dangerous. In our research at Bond University and Murdoch University, Australia, we swabbed 26 mobile phones belonging to doctors and nurses working in pediatric wards and intensive care. On those phones, we identify over 11,000 microorganisms, including bacteria and viruses responsible for serious hospital-acquired infections. Among them were organisms like Staphylococcus aureus and Klebsiella pneumoniae, both well-known causes of hospital-acquired infections. We also found multi-drug-resistant organisms, the so-called superbugs. This is why we describe mobile phones in hospitals as Trojan horses, because mobile phones negate hand washing. You can wash your hands perfectly, but the very moment you touch your phone, you recontaminate them. Remember, your phone is your third hand, and it is the dirtiest one you have. And once you see mobile phones as Trojan horses in a hospital, hey, another question follows. What happens when those same phones cross borders? In 2023, I swapped 20 mobile phones from international travelers attending a medical conference in Sydney. People who had just arrived from 5 different continents. I was primarily looking for bacteria and viruses associated with human disease. What we found instead were living plant and animal pathogens, organisms we were able to culture and grow in the laboratory. In other words, they weren't dead traces, they were viable. Among the organisms found on those phones was Pontohiste wori, a quarantine pest in Australia. It poses serious risk to agriculture and in rare cases has caused severe illness in native Australian parrots. Phones aren't subjected to the same quarantine controls as our luggage, so the microbes hitching a ride simply pass straight through. During COVID-19, we reviewed studies from around the world. In our systematic review, 45% of mobile phones tested carried the coronavirus. This was at a time when healthcare workers were wearing full protective equipment, gowns, masks, gloves, and still holding their phones. Once again, mobile phones may have acted as Trojan horses, quietly undermining even our most extreme hygiene measures. Now, here's the good news. This is not a problem without solution. In fact, it's a very solvable one. At an individual level, the first step is to treat your phone the same way as you treat your hands. If you wash your hands but never clean your phone, you're only doing half the job. Gently wiping your phone, the screen, the back, the sides, with appropriate non-abrasive wipes already makes a meaningful difference. And when you clean your phone, clean your hands as well. That way, you're not immediately undoing the effort. But individual behavior isn't enough in high-risk environments. Hospitals, airports, aged care facilities, cruise ships. In those settings, we can't rely on perfect human behavior. We need systems that make the safe choice the easy choice. That's where rapid, automated phone sanitization technologies come in. Tools that can disinfect a device in seconds without damaging it and without slowing people down. Those kind of systems already exist. What's missing is widespread adoption. In high-risk environments, individual awareness isn't enough. Hospitals, aged care facilities, and airports already understand this, which is why we don't rely on people remembering to wash their hands. We build hand hygiene into the environment. The next step is to do the same for mobile phones. Ultraviolet C, or UVC sanitization, is highly effective at killing bacteria, viruses, and fungi on surfaces, including all the organisms we've been talking about today. Those systems can disinfect a phone in seconds without damaging it. The logic is simple. If we expect people to wash their hands, we also need to give them a way to sanitize their third hand. Left hand, right hand, the phone. In practice, that means placing UVC phone sanitization stations in the same locations as hand washing or hand sanitizer stations, making hygiene complete rather than partial. Ultimately, this requires a mindset shift. We need to stop thinking of mobile phones as neutral objects and start recognizing them as what they are, a third hand, one that travels everywhere, one that crosses boundaries, and one that needs to be included in our hygiene protocols. We've spent, decades teaching people the importance of hand hygiene. But if hand washing is instantly undone by contaminated phones, we're wasting effort, resources, and in some parts of the world, even precious water. What this really calls for is a shift in how we think about hygiene, one that reflects modern life and the devices that rarely leave our side. Let's include mobile phones in how we define hygiene, in our homes, in our hospitals, and in the systems designed to protect public health and biosecurity. Because once you see your phone as your third hand, you realize it deserves the same care, attention, and hygiene as the other two.